I talked about my friend Ann, whose name isn't really Ann, but I talked about her fear of going to get that test to determine whether she has breast cancer or not, because as I said, Mr. Speaker, if she gets the test, she could be denied for pre-existing condition or dropped from her insurance, and if she doesn't get the test, she won't be able to get the treatment that she needs to fight off that breast cancer. She's in a terrible position, but she's not the only one. I want to talk about a few other folks, Mr. Speaker, before I yield the microphone. I want to talk about Mary from Minneapolis. Mary says, my daughter needed her wisdom teeth out. At the time, with insurance, we were told to pay $375, which we did. Then I got billed for over $1,000. Resubmitted, eventually the amount was reduced to $750. Meantime, my husband had no paycheck. I have calcium deposits in my back, which make it difficult to walk, but I can't afford the copays, so I'm waiting until it's so bad that I can't walk. That's what Mary from Minneapolis said with the status quo, which some people in this body want to preserve. Denise from Minneapolis says, I find more and more often that my family and I are skipping doctor visits for preventative care, or even when we would have made a visit to the doctor in the past, but now can't afford the copayment to be seen. This is especially true for childhood illnesses, as well as allergy visits and medication, dental problems that could potentially be very serious, and injuries that in reality should be checked out by a doctor. My family is insured, yet because of our current employment situation combined with rising health care costs, it has come out of our reach, to have the kind of care that we have enjoyed in the past. I feel that being left out for the inability to be able to bear the burden of the cost. This may mean that we will pay dearly in the future for things that could have been prevented or less serious than they had been if we were able to see a doctor. That's Denise from Minneapolis. Here's Janice from Golden Valley, Minnesota, also in my district. I've worked every day since the day I turned 15, and I'm currently 51, married with 2 teenage children. I have a college degree, and we've always lived a balanced and frugal life. We do not take exotic trips and mostly buy generic groceries or thrift discount store clothing. I do not and never have smoked or drank. And I've been at my job for over 20 years, yet I bring home less and less each year due primarily to health care premiums and costs. Health care premiums and copays cost about 25 to 30% of my income. Health care premiums cost me more than my federal, state, Social Security, union dues, and retirement plan deduction combined from each paycheck. The increase has been so great that we have stopped being able to contribute to savings for about 4 years. The one thing I fear more than anything is me or a family member getting sick because of what treatment will cost, even beyond the premium cost. When I have a strange new sensation in my eye, or vein hurting in my leg, or dull pain in my chest, I just pray it will go away on its own because I'm afraid of what it will cost me. We pay out so much for health insurance, yet we cannot afford to really even use it. And I feel even worse for those who have no health care insurance at all. This reflects so badly on what America has become, a place where only the wealthiest survive and the profit by the few takes priority over the basic needs of all. Janice, I want you to know that we are fighting for patients before profits today. I want you to know, Mr. Speaker, about Anita from Roseville, which is not in my district but is very close by. Anita says, I work for a public school and my husband stayed home with our daughter. We started paying health, I'm just tongue-tied tonight, Mr. Speaker. We started paying family health insurance in 2002 at $10,000 out of pocket. This year, we're paying $12,000 out of pocket, and our co-pays are $40 and $50 a visit. Our daughter is school age now, but my husband started looking for work when the economy took its downturn last summer and still does not have a job. Health insurance costs severely limit our quality of life by using up our disposable income. Let me talk about Priscilla from Minnesota. Priscilla got Priscilla says this: I got on my husband's insurance after the job. I had discontinued coverage for me. We paid over $500 a month for this coverage. I had health issues that came on suddenly with breathing problems. It took several hospitalizations and ICU care before they finally figured out what the problem was. My husband's insurance refused to pay for any of it, calling it a pre-existing condition. And by the way, these would be banned under the plan offered by Democrats, calling it a pre-existing condition. Back to it, Priscilla. And we were left with a medical bill for over $25,000 to pay ourselves. This was at the same time we were spending $500 per month on premiums. The provider sent our bill to collections. It has been a nightmare. My husband is now disabled, and we have no coverage. Yet this condition requires regular CAT scans and 9 different medications to make sure his condition is stable. I urge my colleagues who stand in the way of reform to listen to these good, decent people. They deserve better. They deserve better. Let's not worry about what the Chamber of Commerce and what pharma want. Let's worry about our constituents and the patients of America. I'm going to just read one more story from Doug, Mr. Speaker, and then after that I'll make some closing comments. I recently refilled my mail-ordered prescriptions. I get as many generics as possible. However, I'm a diabetic, and both types of my insulin are not generic, neither are blood pressure medication or a cholesterol medication and glucose test strips. My insurance company, in a bid to force generic drugs, has made them free, quote-unquote free, for mail order, while non-generics doubled in price. So I had to choose which ones I didn't need. I chose the glucose test strips because I can buy them over the counter for the same price and quote-unquote ration them by testing less than I should. I'm still spending more money than I can afford, and I'm afraid that my bank account will be overdrawn. If that happens, I will not be able to offer food or gas for myself and my son. I could borrow from my elderly mother, but it looks like they will be losing their insurance coverage from a failing car company. Have a good job with I have a good job with good benefits. That's what Doug said. His last line was, I have a good job with quote unquote good benefits.